Hi, this is the third webinar in the series for My Translation Rules, and it's called Implementation Science, 5 Things to Know Before You Start. I'm Sonia Osborne. I'm an implementation scientist at the Australian Centre for Health Services Innovation, which is also known as OSHI, and I'll be your guide through this webinar. Your key learnings for this webinar are to be able to discuss why implementation science is important to health, to be able to identify 5 factors that limit the translation of evidence to sustainable practice change, and to describe at least one framework for designing an implementation strategy and apply that framework to a real-world problem. So let's get started. Okay, before we start though, let's stop the show here, because in small groups or on your own, what I want you to do is think about a practice change you or one of your colleagues tried to put into place in your work setting. Was it a success or was it a failure? Write down some factors you think might have had an impact on its success or failure. Okay, so stop the tape now. Okay, what did you come up with? All right, let's see what I came up with. So think about those factors you wrote down, and they could probably fit into a few key categories. The first one might be evidence. What was the evidence behind the innovation? Was there evidence behind the innovation? The next one might be to the people who deliver the innovation, the recipients of the innovation, or even external stakeholders that have some interest in your innovation. It might have been the context. And the context is not just where the implementation takes place, but it could also be related to the culture of the place where you're trying to implement something, the barriers that you might be coming across. And then finally, it might have something to do with the process. How are you going to introduce it? How are you going to sustain the change? Did you make plans for that? Who was going to make it happen? Did you have a facilitator? Did you have a communication strategy? So why the focus on implementation? Well, a recent study from Morris et al. Reports that studies estimate an average of 17 years for new knowledge from randomized controlled trials to be incorporated into practice. And that still is variable. It could range anywhere from 5 years to 105 years. So why the focus on implementation? So implementing evidence seems pretty straightforward. You've got your evidence-based innovation. You do some strategies you come up with to implement it, and then you see some outcome, whatever you plan to achieve in your setting. But we know from experience, and you probably have first-hand knowledge of this, some of you, that it doesn't always work that way. It could work in one hospital and not work in another hospital, this very same intervention. So there's something that's happening in between the time you start implementing to the time you get to the end. And we like to say there's a black box there. We don't really know what's in there that's affecting the implementation. And we need to know what's in there if we're going to make some comment about it working and why it's working. So if you think about it in this way, there's 2 very different questions. Does it work? So that's the efficacy and effectiveness questions. Does your intervention actually work? Does it actually produce the results you're looking for? And does it work in the real world? Which would answer the questions where and when it works and why and how it works. And you need the answers to those questions in order to scale it up and roll it out. So Bauer and Schroeder wrote an introduction to implementation science for the non-specialist. And they concluded that the business case for implementation science is clear. As healthcare systems work under increasingly dynamic and resources-constrained conditions, evidence-based strategies are essential in order to ensure that research investments maximize healthcare value and improve public health. So what they're saying is, not only does your intervention have to be evidence-based, but your implementation has to be evidence-based as well. So what is implementation science? Well, it's been defined as the scientific study of methods to promote the systematic uptake of evidence-based practices into routine practice to improve the quality and effectiveness of health services. So it's really focusing on those methods, focusing on those implementation strategies, and making sure that those are the thing that's helping the change. What it does is seeks to understand the behavior of healthcare professionals and other stakeholders as a key variable in the sustainable uptake, adoption, and implementation of evidence-based innovations. So if you look at it logically, you've got your evidence-based innovation, you've got your outcomes and impact that you're trying to achieve, you're doing something, the methods, to actually achieve those outcomes, and those methods are actually focusing on changing behavior. And it's all evidence-based. Remember that black box? Well, if you pay attention to the implementation strategies, some of those strategies you're going to do is to explore some of those contextual items like we talked about earlier, the evidence, how people feel about the innovation, the context, and build that into your plan. And that way you will be able to identify some interventions, some implementation interventions that target those barriers you found, and you can open that black box. So even if the intervention or practice has been demonstrated to be effective by research, so it's evidence-based, if it's not implemented properly or without sufficient fidelity to that model, it will likely fail. So now that we have that background, let's move into those 5 reasons or 5 things you need to know before you start. Or another way to think about it is 5 reasons implementation fails. Number 1, lack of clarity in the aim or innovation. In the words of Albert Einstein, if you can't explain it simply, you don't understand it well enough. So really, what are you trying to achieve? What changes do you want to make that will result in improvement? And what is the evidence to support changes to practice or service? You have to be able to explain it to yourself in order to explain it to others, because if you can't explain it to other people, how are you going to get them to come on board? Number 2, lack of understanding of the context is another reason why implementation fails. It's not all about the base, it's about the context. And you'll hear the word context over and over when talking about implementation. Because the interaction of factors at multiple levels may influence the success or failure of improvement interventions, an understanding of these factors is crucial to an effective intervention. So that goes back to those factors we mentioned earlier and you came up with. The evidence, the context, the barriers in that context, the people, and the processes. So the gap between what is known and what is practiced, and you hear about that gap all the time, that results in health service users not benefiting from advances in healthcare and probably unnecessary cost. A supportive context is considered a key element for successful implementation of evidence-based practice. So how do you find out about the context? Well, the best way is to do a context assessment. You need to know if the area is ready for implementation. And there are plenty of tools out there that will help you to do a context assessment. So just Google context, implementation, and tool. Number 3, why implementation fails. Not including people in the plan or the planning. I'll put this little clip up from Field of Dreams. I don't know if you would remember this movie. But the mantra was, if you build it, they will come. Well, unfortunately, in implementation, it doesn't work that easily. You have to involve people in what you're doing, and you have to look at who your stakeholders are. Anyone who has an interest in the outcomes of your project is your stakeholder. Anybody who has something to gain or lose is your stakeholder, and anybody involved or affected by the project is your stakeholder. So people, groups, or organizations, it doesn't matter. If they've got something to gain or lose, you need to include them in your discussions early. So just a reminder about knowledge translation. It's a circle. You want your stakeholders to be engaged with the research, but you need their input in order to inform what research is happening. So one informs the other. So with stakeholder engagement in terms of with the implementation, it's the direct involvement of the staff, the recipients, and the other stakeholders in providing ongoing input and support that assists you with achieving your aims. And what I mean by ongoing is you need to invite them or include them from the beginning in the planning stages and then keep them informed of what's happening throughout the process. So, number 4. This is the 4th reason why implementation fails: bad planning. So implementation plans should be well designed, well prepared, and preferably pilot tested before you roll it right out. And we talked about behavior change earlier, and that is the whole point of what you're trying to do, is get people to change their behavior. So really your plan, your implementation should be underpinned by some sort of a theory of change. And there are a lot of theoretical frameworks out there, and frameworks or models, and I'll give you a few examples of some, but there are many out there. And so just think about what's right for your setting. So remember earlier I gave you a picture of a logic model. A logic model will also help you to organize and be able to present your plan in a pictorial way that other people can understand it. So theories and models and frameworks, oh my. And the reason I say oh my is because there are so many theories and models and frameworks with implementation science. It's a new field, a new discipline, and so there are a lot of implementation researchers who are trying to work out the best way to do things and evidence-based ways to do things. A lot of the theories and models and frameworks are based on psychological theories, sociology theories, theories of economics. It's a very multidisciplinary field, so it doesn't belong to one discipline. So, but theories are like toothbrushes. Everyone has their own, and no one wants to use anyone else's. So you have to find one that you're comfortable with, and then explain it to other people why you're using it. Now, you don't necessarily have to give them the full detail of the theory, but you know why you're doing it. You know what's driving what you're trying to do. So I'll just give you a few examples now of some common theories that I use quite frequently. We don't have time here to do theories and models and frameworks 101, but I will point you to a good paper by Nielsen and the references at the back. Nielsen it gives us a good overview of theories and sort of divides them into three categories. They're either trying to describe or guide the process of translating research into practice, or they're trying to understand or explain what influences implementation outcomes, or they're simply about trying to evaluate implementation. And then from those aims, those three aims, there's 5 categories. So there's process models, determinant frameworks, classic theories, implementation theories, and evaluation frameworks. With the process models, it's usually a model that specifies steps or stages or phases in the process of translating research into practice to describe and guide the process. With determinant frameworks, they specify types of determinants which act as barriers and enablers that influence your implementation outcomes, and it helps to understand or explain that. With classic theories, they are theories that typically originate from other fields, like I was saying, psychology, sociology, organizational theory, behavioral theory, but they can be applied to help us understand or explain why change is happening. Implementation theories. These are theories developed by implementation researchers, and these are probably, in the past 10 years, because that's when the field has been developing. But they try to understand or explain, and so they're usually underpinned by a lot of different theories. And then evaluation frameworks would specify aspects of implementation that could be evaluated to determine implementation success. Now I'll just give you a few examples. The first example I'm going to give you is the Behaviour Change Wheel, which is by Susan Michie and colleagues, and it incorporates the CALM-B theory. In this behavior system, capability, opportunity, and motivation interact to generate behavior that in turn influences these components. So you can see on that wheel, the green part are the sources of behavior, capability, opportunity, and motivation. The red part are the intervention functions, and the grey part are sort of policy categories. So just in defining some of those, the sources, capability is defined as the individual's psychological and physical capacity to engage in the activity concerned, so they can do it. Opportunity is defined as all the factors that lie outside the individual that make the behavior possible or that prompt it, so it's possible to do it. And then motivation is defined as all those brain processes that energize and direct behavior, not just the goals and the conscious decision making. So they want to do it. So if that's a theory you're subscribing to for your plan, then when you do your needs assessment and you find out your barriers and facilitators, you can work out what sort of strategies you need to help change behavior. Hain and colleagues sum it up pretty well for us. They tell us that changing behavior is not easy, and you probably know that from experience, but it is more effective if the interventions are based on evidence-based principles of behavior change. So keep that in mind when you're thinking about the strategies you're using or the interventions you're using to implement your innovation. The next framework I want to talk about is the Promoting Action on Research Implementation in Health Services, or PARISH, and it's been revised, so it's now called iParish. And this is by Harvey and Kitson and colleagues, and they this revised version is called an integrated framework. So it's used as an explanatory framework, and it posits that evidence is a multidimensional construct. embedded within innovation and operationalized by clinicians. And those by clinicians, I'm meaning individuals and within teams who are working across multiple layers of context. So facilitation for them is the active ingredient that promotes successful implementation. So you could see their framework is really divided into 5 domains: characteristics of the innovation, the recipients, the inner context at the local level, the inner context at the organizational level, and the outer context. And in the blue part, I've put in, or they've put in what the facilitator looks at, and then the red part is what the facilitator does. So this framework actually gives some guidance to the facilitator. So the next example I'm giving you is the Consolidated Framework for Implementation Research, or CFIR. And this is developed by Dan Schroeder and colleagues, and I've given you the reference at the end. The CFIR can be used to help guide formative evaluations of interventions in context, and it also offers an organizational framework for synthesizing and building knowledge about what works, where, and across multiple settings. And you might see some familiarity with the iParish. The CFIR is composed of 5 major domains. Surprise, surprise. Intervention characteristics, outer setting, inner setting, characteristics of the individuals involved, and the process of implementation. And of course, under each of these domains, there's a number of constructs. So this is another good framework you could use to help guide not only the identification of barriers and facilitators, but also drive your evaluation. So when you look at the various frameworks, models, and theories, you'll start to see a pattern of some key aspects that are common across them. And we've already talked about this, and you've already identified this early on in the workshop. Things to do with context, things to do with people, things to do with the processes that you're using, and things to also do with the evidence. The last framework I'm going to talk to you about is the Theoretical Domains Framework. And this again is by Michie and colleagues. And this is a framework that was developed from a synthesis of psychological theories. And it was developed by consensus with 18 researchers from health psychology and 12 implementation researchers across the world. So it took 33 theories basically and 128 key theoretical constructs and then synthesized them down to 14 domains. And later it was revised synthesized to 12 domains, but later revised to 14 domains. So this framework can be used to explain implementation failure or to design implementation interventions, because what those domains are really are drivers of behavior. So if those are what you identify when you do your needs analysis as being drivers of behavior, then you can target your interventions at those particular domains. So number 5, why implementation fails? Failing to build support for sustainability and scale up. And what I mean by that is failing to build into your plan, into your processes, mechanisms to ensure that the evidence-based intervention or innovation is going to continue when the project team backs out, whether that has to do with funding or whether that has to do with key people. That has to all be thought about early in the program, in the piece. So 4 things probably come under this. One would be evaluation of process and outcomes. So most people try to collect clinical outcomes, but you really need to collect some outcomes on the process so that you can determine what and why and how the implementation worked. Also addressing those contextual barriers, and we talked a lot about context and assessing the context. Keeping people engaged and informed of the progress. So you're engaging stakeholders from the beginning, you're getting their input into the plan, and you're communicating with them throughout. And then another important concept is fidelity to the innovation and to the implementation plan. So fidelity means that what you set out or intended to do is what you actually did, and that's what you're evaluating. If your plan is ever changing, then you can't actually evaluate an effect of what you started with. So there has to be some way to capture if the plan has to change, and it probably will have to change because you're being reactive or to the context, but you have to be able to record those adaptations and explain why you've made changes to your plan. So that's probably enough about that. Actually, I will tell you a little bit more about fidelity because this is something you can be thinking about in your planning phase. Alan Linman and Emmons worked around fidelity. They did some research on fidelity and came up with a model to help us, I suppose, measure fidelity. So they, some of the components of fidelity that you would be measuring would be adherence to the intervention, exposure or dose, quality of delivery, participant responsiveness, and program differentiation. And you can see some of those influences on fidelity on the left-hand side of that slide. Some influences you might already be familiar with. The implemented characteristics, the intervention, the organizational setting or context, and the population or your recipients. So let's stop the show now and see how much you've learned. In groups or on your own, answer the following. Why is implementation science important to health? And what 5 factors can limit the translation of evidence to sustainable practice change? Or if you want to think about it another way, what are 5 things you can do to help with your implementation? So the 5 things to know before you start. Be clear about your aim and innovation. Understand the context. Engage people throughout the process. Develop a clear, logical plan for change, and build support for sustainability. Did you get those? Designing and planning an implementation strategy should be a collaborative and coordinated effort between all stakeholders involved in the initiative. Stakeholders should be in agreement about the need for change, about the appropriateness of the innovation, and about the purpose of the initiative. Many implementation efforts are not sustained, and we know this. So processes to support sustainability need to be established during the initial stages and then anchored at various stages along your process. Customizing the implementation may promote more positive attitudes towards the implementation, and you're customizing your implementation because you're assessing your context and you're tailoring it. So that's the end of this webinar. I hope you got something out of it.